Hello, my name is Chantal Migone and I'm a specialist in public health medicine at the National Immunisation Office. And this module is about communicating with people about COVID-19 vaccines. This is version 3 of the module and is current at the time of publication on the 1st of February 2021. The learning objectives of this module are that at the end of this training module, you will understand the key principles on communicating with people who are undecided or hesitant about vaccines. You'll learn skills to listen and engage in conversations aimed at building trust in vaccines and be able to respond to concerns regarding COVID-19 vaccines. The COVID-19 immunisation programme presents challenges for the public and for vaccinators because we have new vaccines. We have new technology in the form of mRNA vaccines. There's a big media and a social media focus with a lot of information out there, which is both real information and misinformation. And vaccinators and healthcare workers, especially in the initial period of the vaccination programme, have no experience of the vaccines. There are also a number of unknowns. For example, what is the duration of protection from the vaccines? Will we need booster doses? And what are the effects of the vaccines on transmission of the virus? So what do we know about the vaccine acceptance continuum for other vaccines? Well, we know that there are different views regarding the acceptance of vaccines amongst people and different scales. So for example, some people will accept all vaccines and will be very certain that they will get a COVID-19 vaccine when it's offered to them. A small proportion of people will be very sure that they will refuse any COVID-19 vaccine that's offered to them. But then there are the people in the middle who are unsure, have some questions, and are uncertain. And it is really this group of people that this module is focused on. You will have heard the term vaccine hesitancy. And vaccine hesitancy is defined by the WHO as a delay in the acceptance or refusal of vaccines despite the availability of vaccination services. And it's complex and it's context specific, varying across time, place and vaccine. So that means that an individual's views on COVID-19 vaccines may vary depending on the time, for example, the beginning of the immunisation programme or in the middle of the immunisation programme, and also might be different for different vaccines. This slide shows the results of the AMORIC survey, which is a survey conducted by the Department of Health periodically to understand people's views regarding COVID-19 and COVID-19 vaccines. And you can see here on the left of the slide, the proportion of people who replied to the question, will you get the COVID-19 vaccine when it is offered to you? And these are people who had not yet received the vaccine. You can see in the green line is the proportion of people who said they definitely would get the COVID-19 vaccine when it's offered to them. And you can see that the proportion has increased over time, so that it's 67% at the end of January 2021 versus 45% at the end of November. This may have been influenced by the surge in COVID-19 cases that occurred following the opening up of services, etc. And also you can see that the proportion of people who are definite that they will not get a COVID-19 vaccine is low at just 4%. But then there are those people in the middle who replied probably, probably not, don't know, etc. And these are really the people that we are focusing on for this module. You can also see on the right that the proportion of people who said they definitely will get a COVID-19 vaccine varies depending on age. So older people were more likely to, more older people were more likely to say that they would definitely get the COVID-19 vaccine versus people who are younger, those under 35. So what influences people's acceptance of vaccination? Well, we know that it's complex and it's context specific, and it's influenced by 3 factors: complacency, convenience, and confidence. So first of all is confidence, which is really important, and that's people's confidence that the vaccine is safe and that it's effective. The second is complacency, and that means complacency about the disease that the vaccine protects against. So there may be people who may be complacent about the severity of COVID-19 and the serious effects of the disease. And then the third is convenience. And we know for other vaccines that the more convenient it is to get a vaccine, the more accessible it is, the more likely people are to get the vaccine. So where do people get information from about vaccination and COVID-19 vaccines that might influence their decisions? Well, we know that there's a variety of sources, including from their healthcare professionals, such as their GP or practice nurse or pharmacist, from other healthcare workers, from information that's available on websites such as the HSE website, the WHO, etc. Also social media, broadcasts, TV, radio, etc. Also from family and friends, spouses, partners, and work colleagues. So this just goes to show that you as healthcare professionals will be asked about COVID-19 vaccines in a professional capacity, but you may also be asked about COVID-19 vaccines in a private capacity by your work colleagues, your family, your friends, your spouses, and your partners. And communication about vaccines will be important in all of these settings because they can have an influence. So what do we know is effective for other vaccines for people who might be hesitant about vaccines for COVID-19? Well, we know that no single strategy can address vaccine hesitancy, but healthcare professionals we know are the most trusted source of information of vaccines, and what healthcare workers say and how they interact with a person can strongly influence vaccine acceptance. And therefore, skilled communication by healthcare workers about vaccines really matters, and that's what this module is focusing on. This slide shows the trust that people have in Ireland in healthcare professionals to give them information about health and about vaccines. This is from the Wellcome Trust Global Monitor in 2018, and this was obviously before COVID-19, and it just shows that overwhelmingly a healthcare professional was the most trusted source of information. So then how can you as a healthcare professional build trust in COVID-19 vaccines? Where there are two really important aspects. One is competence and the other is caring. So first of all, there's competence. So being competent and transparent about the vaccines is really important in building trust. So that means being informed about the vaccines, sharing information about the different vaccines' effectiveness, sharing information about safety and risk, being confident about vaccine manufacturing safety standards and licensing from the European Medicines Agency under the HPRA, and building trust in national decision-making processes, for example, the National Immunisation Advisory Committees. The second really important aspect is about caring, because emotions matter when building trust. So it's not about just what you say, but it's also about how you say it. So a couple of principles here. Remember to take into account the feelings and concerns of the person, offer the time and space for the person to digest information and to ask questions, and acknowledge and validate the perceptions of people before advising them. And always tell the truth, even if admitting that you don't know, but that you go back and find out information about the question and get back to them. So when addressing a conversation with somebody who's hesitant about vaccines, the first is to understand where the person is in the vaccine acceptance continuum. So are they completely against vaccines, or do they have some doubts? They're uncertain. So they might say something like, I definitely don't want to get the vaccine, I don't trust vaccines, and I'm never going to get a COVID-19 vaccine. So that's somebody who's refusing. But people who say things like, I don't think I'll get it, I'm not sure if it's safe, I have my doubts, I don't know, and they are those people who are undecided, and that the skilled communication will really matter. And the aim is really to move the person who is hesitant or uncertain to accept vaccination. So how to proceed then if you've decided that it's somebody who's uncertain and is in the middle zone and has questions and is unclear or uncertain? Well, the WHO describes the conversation as a collaborative and person-centered conversation with a participatory approach. And that means that the person is involved in the conversation and that you come to a decision mutually about the decision that's best for them. So this slide shows you how that conversation might go. So the first thing is to be respectful and open. Ask the person open-ended questions. So if they say, I don't know if I'll get the vaccine, I'm worried about it being safe. Ask an open-ended question, something like, can I ask what you're worried about? And when they tell you what they're worried about, affirm strengths and acknowledge and validate their concerns. So you could say something like, It's good that you're looking for information about the vaccine, and I know that it can be worrying when you read things like that online. And then address their specific concern. So if they tell you, for example, that they're worried that the COVID-19 vaccine might interact with their DNA, then address that concern. So say, it's good that you're looking for information about the vaccine. It can be worrying when you read things like that online, but the vaccine doesn't interact in any way with your DNA, and explain the reasons why. But don't bring up any new concerns, because bringing up new concerns may help to propagate the myths, even if you're dispelling those myths. Stress the positives, that the vaccine protects against a serious disease and why that's important for them as an individual, and point to other sources of information, for example, the HSE website. Leave the door open to them to come back if they have more questions or if they're still undecided, so they know they can come back and talk to you. And remember to recommend the vaccine. So say, I recommend that you get the vaccine, because we know that a recommendation by a healthcare professional has been shown to affect people's decision to take up a vaccine. You can also, if you like, give your own personal experience of the vaccine. That can be quite powerful. So you can say, well, I got the vaccine. And you can also let them know how they can get the vaccine. So how they can make an appointment and access the vaccine. So what about the people who are definitely sure that they won't get the vaccine? They're certain that they will never get the vaccine. Well, these can be challenging conversations to have, and they can be frustrating also, and can take up a lot of time. So the first principle is to be non-judgmental, even if you are really very opposed to what they are saying, or very certain that what they're saying is wrong. But say something like, I can see that you feel strongly about this and that you want to do the best for your health. Ask permission to discuss the COVID-19 vaccine. Something like, would it be okay with you to talk about vaccination against COVID-19? And if they agree, then take the approach of the previous slide. So ask open-ended questions and focus on their specific concerns. But don't enter into a debate or an argument. It may be that as you are trying to explain one of their concerns, that it becomes an argument, and this can take a very long time and can be unproductive. So if you can see that it's entering into an argument, you could say something like, I can see that you feel strongly about this, but don't continue in that argument because it's likely to be unproductive. Leave space for any future discussion. So say something like, please know that if you ever want to talk about vaccination, you're very welcome to come back. And the aim here is really to maintain the relationship with the person so that the door remains open if they do change their minds and if they want to come back and talk to you more about the vaccine. So now we're going to move on to some questions that you may be asked about COVID-19 vaccines from people who may be undecided or uncertain about vaccines. So the first is, do COVID-19 vaccines affect our DNA in any way? And the answer is that no, they don't. So mRNA vaccines, Comirnaty and Moderna, the mRNA never enters the nucleus of the cell, which is where our DNA, our genetic material, is kept, and it does not interact with our own DNA. And the cell breaks down and gets rid of the mRNA soon after it's finished using the instructions. As regards the AstraZeneca vaccine, the viral adenovirus vector enters the body cells and delivers the genetic code for the spike protein. The human cells then produce the spike protein, but there are no changes to the human DNA. So again, the vaccine can't interact with our DNA in any way. Do COVID-19 vaccines have any effect on fertility? Well, COVID-19 vaccines, as we've said already, do not interact with your own DNA or genetic material in any way. So there is no biologically plausible reason why the vaccine could affect fertility in any way. And also, animal studies do not show any harmful effects on fertility. Some more questions that you might be asked. Can COVID-19 vaccines give someone COVID-19? And the answer is no. COVID-19 vaccines do not contain the live virus that causes COVID-19 and cannot cause COVID-19. Can COVID-19 vaccines cause people to have a positive COVID-19 nose and throat swab test? And the answer is no. They do not affect a PCR swab test, which is the basis of diagnosing COVID-19 infection in the nose and throat. And they also cannot affect antigen tests if they are used. The antibodies produced following vaccination may affect the results of a COVID-19 antibody test, but that's only if the test looks for antibodies against the spike protein of the coronavirus. However, antibody tests aren't used to diagnose COVID-19, but it may be something that people have heard, and it's important to know the difference. Another question, COVID-19 vaccines contain genetically modified organisms, and Comirnaty and COVID-19 vaccine Moderna do not contain genetically modified organisms. However, the COVID-19 vaccine from AstraZeneca contains a genetically modified adenovirus, and 2 changes or modifications to this adenovirus have been made. The virus has been modified in the laboratory so it cannot multiply inside your body, and the genetic code for the coronavirus spike protein has been added. And these changes to the adenovirus allow the vaccine to deliver the spike protein genetic code to the cells without causing COVID-19, and the body then makes antibodies which can fight infection. Some other questions that you might be asked about COVID-19 is the question about whether COVID-19 vaccines contain cells of human embryonic origin. And mRNA vaccines do not contain cells of human embryonic origin, and they are also not developed from cell lines of human embryonic origin. COVID-19 vaccine AstraZeneca does not contain any cells of human embryonic origin. There are no human cells or cells of embryonic origin in the vaccine. However, the cell lines that are used in the vaccine to make the vaccines are cells of human origin. They're human embryonic kidney cells. And these cells are used to grow the adenovirus that's contained in the vaccine. The cell lines that were started in the 1970s using small quantities of kidney cells, and these were taken from a fetus following a termination. And this was a voluntary termination, and the mother had consented to the termination. And the termination was not done for the purpose of vaccine development. So since that time in the early 1970s, cell lines have grown independently, and the descendant cells of these cell lines are not the cells of the terminated fetus. And it is these descendants that are used to grow the adenovirus. So the original fetal cells have long since disappeared, and none remain at the time the vaccine is administered. And this can be a difficult concept to explain, but certainly if somebody is worried about this, you have the information and you can adapt that information to the person who's asking the question. Something that is helpful is that the Catholic Bishops' Conference in Ireland has made a statement that it is morally permissible for Catholics to accept a vaccine which involves the use of fetal cell lines, particularly in a pandemic situation. And there is a link in the slides to their statement, which is available online and which may be helpful for people who are concerned about this. Just to say that there are more frequently asked questions and answers in the clinical guidance for healthcare workers, which is available on the NIO website at www.immunisation.ie. So in summary, healthcare professionals are the most sources of information on health and on vaccines, and skilled communication by you, a healthcare worker, about vaccines matters, because a skilled communication with a trusted healthcare professional can strongly influence vaccine acceptance. There are more resources and links available from the World Health Organization, including training for healthcare workers, and the links are included in this slide. Thank you.